Happy Medical Billers Day! We have reached the fourth part of our series, and today is Medical Billers Day, March 28, 2024. So I hope you are out there representing for us billers. This shirt you can check out in my shop, so I hope you picked it up. But I'll have it there for a couple of months so you can still pick it up and represent. Just let people know this was the day that Medical Billers Day was in 2024. We're on the fourth part of the series of our 4 Basics of Medical Billing, and we are talking all about patient billing. So keep watching if you want to hear more about that. So patient billing can be looked at as the last part of medical billing, but there really is never a last part. So you may bill a patient and the patient may tell you that, oops, I had another insurance. So then you have to go and bill the insurance and you kind of start the process all over again. So patient statements is not the last part of billing, but it is the last part that we're going to be talking about in this 4-part series of the basics of medical billing. Now, I always recommend collecting patient payments up front because that would diminish how many patient statements you need to send out on the back end. But it's not always possible to do that. Sometimes you just cannot figure out how much it is that they owe. Sometimes you think you figured out how much it is that they owe, but then you send it to the insurance and they tell you that it's another amount. Determining the patient's copay may be a little bit easier because copays are usually flat rate amounts that are like $30, $20, $45. So regardless of what the fee amount is for that day, the patient only has to pay that specific copay. If you can collect the exact amount or close to the amount that the patient needs to pay up front, I would always recommend that. Also because cost share for patients have gotten higher and higher. And so if you decide that you're going to wait till the insurance pays their portion, thinking that the insurance is going to pay the majority of that fee, you may be in for a rude awakening. If a procedure is $5,000 and you're thinking, oh, well, the insurance may pay the bulk of that. They may pay $4,000, $4,500, and there's only like a little bit of outstanding left for the patient. But because cost share for patients have gotten higher and higher, that patient may owe the complete $5,000. Another thing I always say is to never guarantee a patient a specific price, even if it's a copay. Even if you know that the patient owes a $20 copay and that is what they would owe for the visit, I never say all it is for today is $20 because you will never know if the insurance is going to actually pay the balance of that or it might have changed. The patient might have changed their policy and they don't know that their copay has also changed, so they didn't give you any new information. So never ever guarantee a price. Always let the patients know that it's just an estimate and there's never a guarantee of coverage until the insurance pay. Now, I know you've heard that spiel when you've called the payers, and they say that because what they quote you a lot of times is not even correct. So they're trying to cover themselves, and you also need to cover yourself when you're talking to a patient. But if for some reason you don't know what copays or coinsurances is or deductibles is, I will link that video below so that you can figure out what it is, because if you need to know anything, that is definitely one of the things that you're going to have to learn. So before billing a patient, I always recommend 3 things. And the first one is to check and make sure, or double check and make sure that when you send that patient out a bill, the bill is correct. That it is the responsibility of the patient. Now, you may send out the bill and the patient tells you that I have another insurance, so I should not be paying for this. But you need to make sure that you have done all your research in your office to make sure you don't have another insurance on file, that the patient didn't call in and let you know, or any of that before you actually send the patient a bill. You also need to make sure that the patient was not covered by a payer that does not require a cost share. So payers such as that is MAP, which I say, but it's Medicaid, VA, which is veterans, and a few others. Patients don't have a cost share with these payers, and by law, especially if you've signed a contract, you cannot bill these patients for the outstanding amount. So you need to make sure that they don't have a payer that says that they do not have a cost share. You don't want to make that mistake and be trying to get money from a patient that has a payer who's supposed to pay 100%. And last, you need to make sure that the patient's payments and the insurance payments have been posted to the patient's account. There are times when the patient has paid in advance, but their payment have not been posted. So then it shows that they have a balance when they should not have a balance because they've already paid. Also, if the insurance has paid, but you have not posted the payment, you may have the impression that, oh, the insurance is not going to pay at all, so then you're just going to move everything over to the patient responsibility. Or because you haven't posted the payment for the insurance, you maybe have collected too much on the front end and the patient doesn't actually owe all of that. They may just have a credit. So long story short, you need to make sure that the patient's payments are posted and the insurance payments are posted before you send out any bills to the patients. And you might be asking, how often should I send out a statement? And my answer is, it all depends. That's an answer that I give often because it all depends on your practice, your specialty, what you want to do, your policies, all of those things. But I'll say this. You need to make sure that it is consistent. So if you decide to send out bills every other month, every year, whatever you decide, you need to make sure that it is consistent. I would say that most practices send out their statements monthly, and that is a common rule, but it doesn't have to be for yours. You need to make sure you do what's best for your practice. And here are some tips for patient statements. And I'll link above a video that I did about understanding patient statements, where I went through all the parts of a patient statement that you should have to make sure that you maximize your chances of receiving payment by the patient. And number one is to make sure that you are sending out statements when they need to. If you are a practice that sends out statements when it is not needed and the patient has to keep calling and telling you that I already paid, that I this, that I that, when you send out statements that are true, they're not going to take it for what it is. They're going to think that, here we go again, I don't really owe, but they're sending me a statement, and then they're going to start to ignore the statements. Then you need to make sure that you are consistent. I stress being consistent because when you keep it in the minds of the patients that if they don't pay or if they have a balance, they will be getting a bill, then they will be more likely to make a payment towards that bill. They know that they've been seen, that they want to continue being seen, so make it a consistent practice of sending out patient statements. 3, the statements need to be concise and comprehensive. I hate getting a bill that says nothing on the bill. I need to know why you're sending me this bill, what's the date of service, what did I have done, what did my insurance pay. All of those things need to be on the bill. I don't want a bill that says you owe $50 because I am not paying it. If it just says that I owe $50, I need to know why I owe $50. You need to explain it to me and it needs to be clear, okay? So make sure that your statements are concise and comprehensive and you will get more payments for your patient statements. Last but certainly not least is to make sure that there are different ways that you send out these statements and different ways for the patient to pay. So different ways to send out the statement, meaning if you send it out by mail, you might send it out by text, you might send it out by email, whatever. Whichever way that you send it out, make sure that it is secure and HIPAA compliant. But have different ways to send out the statements. Nowadays, some people don't even check their mailboxes. They don't want anything that's paper. They don't look at anything that's paper. So you may need to be able to send it in another way. Then when it comes to actually making a payment, never make it hard for the patient to pay. If the patient wants to pay over the phone, if the patient wants to pay by cash or check or credit card, try to find a way for them to pay. You don't want to only have one way to pay you, and when you let the patient know that they can't pay you in that one way, then most likely you're not going to get paid at all. Don't make it hard on the patient to pay you. Make it as easy as possible so that you can get your money and they can get the services paid that they need to get paid and continue to go to you in the long run. So we have reached the end of our 4-part series. If you haven't checked out part 1, 2, and 3, I will link that above for you and below. And happy Medical Billers Day. Make sure that you're celebrating it today and that you'll celebrate it for years to come so people can understand how important medical billers are in the healthcare field. Make sure you check out this playlist where I talk about the revenue cycle in healthcare, and I will see you again in my next video.